Did you know that ceramic implants can have a twin sibling? Yep, with the Swiss brand Zeramex, that's exactly the case. But who is their lookalike and what upsides and downsides do these two implants share? Let's break it down in this video. Hi, my name is Dr. Tobias Steinherr. As a specialist for ceramic implants and metal-free dentistry, I am teaching you the dental skills, the biological concepts, and the practical implementation of ceramic implants into your practice to increase your revenue, to decrease your stress while creating healthier smiles for healthier patients. We have already chatted about SDS, Zeraroot, and Straumann's Pure System. Today, we are hitting two ceramic implant systems at once, because they are like twins, the same look, different names. We are talking about Zeramex and the Nobel Pearl implant from Nobel Biocare. Founded back in 1981 in Sweden, Nobel's headquarters are now in Switzerland, just like Zeramex and pretty much every other major player in the ceramic implant market. So here's the scoop. Nobel teamed up with Dental Point, the folks behind the Zeramex systems, to offer a ceramic implant under their own brand called the Nobel Pearl. So for the rest of this video, I will focus on the Zeramex implant because everything I discuss applies equally to the Nobel Pearl. In fact, both companies even mention on their websites that the Zeramex XT and the Nobel Pearl are compatible. Because to be specific, it's the Zeramex XT that's the same as the Nobel Pearl, or actually the other way around. Before 2017, Zeramex had the P6 as its ceramic implant system, which is funnily enough another ceramic twin, as it looks a lot like this classical Straumann standard plus tissue level implant, and that's, as you know, one of the most successful and well-studied titanium implant systems out there. We've talked about it before in our video on Straumann's Pure System, which you can check up right here. Maybe they thought, why change a winning system? You could even use Straumann drills and follow the same protocol to place these implants, but with the release of their XT series, Zeramex stopped producing the P6 in 2021. You can still get parts until 2031, but the implant itself is off the market. Alright, enough of the ceramic implant gossip. Let's jump straight into the facts about the Zeramex XT. Well, Zeraroot offers only one-piece zirconia implants. Zeramex has only two-piece implants in their lineup. The implant is placed to extend about 0.6 mm above the crestal bone. This creates again, and like with other two-piece systems, a zirconia to zirconia connection, which doesn't seal off completely, as we know, and might mess with our biological width and proper connective tissue attachment to the zirconia surface. Because the abutment interface to the implant is more flat and lacks a conical or a tube-in-tube design, it might be even more prone to biofilm formation inside compared to other systems, but that's just an educated guess based on design, material, properties, and my own experience with a handful of Zeramex cases. I don't see enough patient cases with Zeramex myself to say if it's a real issue. So if you are a Zeramex user, drop your experiences in the comments below. Now, when it comes to stability, the flat design interface of their abutments with only 4 peaks leads to a pretty solid implant neck area. What might be a bit of a downside biologically actually adds to the stability, but this brings us to the next crucial category for a two-piece implant, and that's the screw connection. Since the abutment itself can't absorb much force under dynamic loading, you gotta rely on the screw connection for your long-term stability. Zeramex uses a metal-free option, a carbon fiber reinforced screw called Vicarbo. They say this screw acts like a bolt, anchoring the structure in the implant. The super hard ceramic combines with a very stiff carbon fiber reinforced high-performance PEEK material. They compare it to reinforced concrete. The ceramic handles the compressive forces, while the Vicarbo screw counters tensiles and bending forces. If you like the content so far and want more valuable info on ceramic implants, I would really appreciate if you hit the like button and subscribe to my channel, because I drop new videos every single week. But back to the topic, looking at simplicity versus variability. The system offers 3 diameters. It's a 3.5, a 4.2, and a 5.5 millimeter, and 3 different lengths, 8, 10, 12 millimeters. The 4.2 millimeter diameter also comes with 14 millimeters in length, which can be super handy for immediate implants. The conical implant body and thread design give you primary stability, making the implant suitable for both immediate and delayed placements. When it comes to prosthodontic restorations, there are plenty of options, just like with a typical titanium bone level implant. So it's not as simple and straightforward as with SDS or CeraRoot, for example, but it's perfect if you're used to a more technical approach and want a variety of parts to choose from. You've got 3 ways to take your impression. You have scan bodies for intraoral scanning and impression pose for both open and closed tray techniques. You can choose from standard abutments with 2 different gingiva heights and an angulated version, as well as different bases to craft screw retained restoration. There's even an option for a custom abutment. You can design an exocad and of course abutments without the pins for your bridge work. On top of that, you've got locator abutments in different gingiva heights if you need to fix removable dentures. So everything feels pretty familiar if you're used to a classical titanium implant system like I mentioned earlier. To sum it up, the Zeramex XT is a ceramic implant system that's versatile without being overwhelming in terms of parts and options. If you like having different parts and abutments to choose from and prefer the more classical workflow of taking impressions with impression pose and open and closed trays, this system might be right up your alley. It offers all the essential lengths and diameters you need and takes the material properties of zirconia into account in its design and screw connection. But here's the kicker, its screw connection combined with the flat interface could lead to issues down the line like biofilm formation and screw losing. So with a system like this, I would lean towards screw retained restorations to tackle any problems if they pop up in the future. If you want all this info, not just about the ceramic system, but all the major implant systems to compare option, pros and cons, head down to the description box and download my Zirconia Systems Black Book for free. It gives you all the important facts at a glance, so you can choose the perfect system that fits your needs. So far, we've covered SDS, CeraRoot, Straumann, Zeramex, and the Nobel Pearl, but we've still got some systems to talk about, so make sure to subscribe so you don't miss the next videos. Catch you next time, and always remember, if we can do better, we should do better.